Let's get this recording. So Dr. Jarvis, we've had the BA.5 variant circulating for a little bit now in Maine, maybe a couple of weeks. What are your observations about how this is infecting people and how it's presenting, and what makes it different from what we've seen of other Omicron variants?
Yeah, I'll start with the presentation part first. It really has not been showing up to be any different than we've seen with the last few Omicron variants for most people. So those that get infected, most of them will have mild cold-like symptoms and then get over it. Though I will say that I have heard from a few patients who have been infected with a prior variant and then got infected with what we suspect to be BA.5. Have said that this time they felt that the symptoms were stronger or more severe than they had seen before. The reason why we're seeing so much of this, though, is that this particular variant is far more infectious, not only than what we've seen with prior variants of coronavirus, but far more infectious than most viruses that are out there. In fact, right now, the World Health Organization is looking at this as possibly being the most infectious virus we have, beating out measles, which currently is the most infectious virus that's out there. So, that should be a cause for concern. And it does seem to have the ability to evade immunity, whether that's immunity from a prior infection or from vaccination. And so, again, that leads to more of that spread. The good news is for those who are vaccinated, particularly those who are up to date on their vaccines for whatever their recommended boosters are, those continue to protect you from severe disease, hospitalization, and death. And of course, those are the most important things. But, getting infected and feeling sick isn't a great thing either. And so that's one of the concerns we have.
Are we seeing the severity of the illness in terms of people being hospitalized or having to do critical care and ventilators? I mean, we've been tracking kind of the statewide trends in those numbers, but as it relates to BA.5, are we seeing the severity of the illness be less than previous variants, especially like Delta or the original Omicron?
So it appears that way. Again, in Maine, probably still a little bit too early to tell because our numbers are relatively low. But when we look around the country, there really does not seem to be a spike in people who are requiring hospitalizations, ventilators, or death outside of an increase in the sheer volume of people who are being infected. So that's good news and welcome news for us, and tends to follow the history of respiratory viruses as they evolve. That they become more infectious but usually less where they're causing more severe disease. And so it appears that's what we're seeing, but it may still be a little bit early for us to tell because, again, overall, our numbers aren't like what we saw with the huge Delta wave or the very beginnings of the Omicron wave, where we saw a tremendous amount of people, and that gives us a lot more information. But there are some pockets in the United States right now where both BA.4 and BA.5 subvariants are causing significant increases. And again, Maine typically trails behind everybody else. So I think it's a word of caution for us that while right now, relatively low numbers out there, still certainly spread of disease in our communities, but it may look like at the end of the summer, the beginning of the school year may be a rough time for us again.
Okay, so do you, what would you recommend to people who, regardless of their status, right, being up to date on their shots, or maybe they, are not up to date on their shots? Are we expecting that people will be advised to start wearing masks indoors in public places again? I personally haven't had a chance to check the US CDC's community transmission and community levels maps yet this week, so I don't know kind of where that stands. But given what this subvariant can do in terms of evading people's immunity, do you expect that that's in our future?
Yeah, it could very well be. Like I said, there are pockets around the United States where public health is now strongly encouraging people to wear masks while in any indoor setting. We are not there. Most of our counties in the state of Maine are in the low community risk category. I believe Aroostook County is the only one right now in the medium risk category. But when we look at actual transmission, if we remember a year ago, right before July 4th, here in the state of Maine, we had almost no virus going out in our communities. That's not where we are right now. We are higher than we were there. we're just much lower than any surge that we saw. So I think there's that comfort level from that, but we got to remember there is circulating virus, and there's still certainly a large number of individuals who are becoming infected in Maine every single day. So with that said, I still think that wearing masks indoors, particularly if you're going to be in an indoor location where there's a lot of people and you're going to be in there for a prolonged period of time, masking is probably still a good idea, especially if you're vulnerable to high risk of disease. Because you have an underlying health condition, or you're immunocompromised either because of an underlying health condition or a treatment for an underlying health condition, those people should definitely consider wearing masks. If you're over the age of 60, you should definitely consider wearing a mask in those settings. I think the rest of us probably need to just continue to monitor what's out in our communities. And if we start to see an increase, then go back to those same kind of precautions that we've talked about. But most importantly is to keep up to date on your vaccination. So if currently you are recommended to get a booster shot and have not received the appropriate booster shot for your category, you should be reaching out to your provider or a local pharmacy to get that booster shot.
Got it. Let's talk about those. Actually, I've got 3 questions for you. They're all related. And one of them is, I guess, more of a yes or no. Remind me, is there a panel of health experts in the state that advise our governor, other local politicians about instituting those types of mask mandates? Are you part of that, if there is one?
So there's no official policy government like that. I mean, they come from recommendations from the Maine CDC. I will say that a group of physician leaders across the state do get together on a regular basis, and we do discuss what trends are happening and make at least comments but not true recommendations. It really is just to make sure that we're all on the same page and that we're doing the best we can for our communities. And so, yes, I am a part of one of those groups that does that. And it's important that people know that our physician leaders across the state do get together on a regular basis with the state to discuss those kind of issues.
Gotcha. I mean, in that case, as part of those discussions, have talks about requiring masks in indoor public places come fall. Has that been on the table yet, or is that just too far?
No, we continue to advise that we follow the federal CDC's guidelines for both transmissibility and community risk. And so I think those are still very good guidelines for people to follow and monitor. And I think, that's probably what we will stick with, at least for the foreseeable future.
You talked a second ago about boosters. There's been a lot of discussion at the national level about sort of tweaking the formula behind these boosters to make them very targeted towards the Omicron variant and its subvariants. Any clarity or insight that you can provide about maybe people under the age of 50, right, who haven't been given that recommendation from the federal CDC yet to get a second booster? Any insight? We expect that to be coming soon. Do we know is the formula going to be tweaked to kind of fit that or protect against these variants and subvariants?
Yeah, so both the FDA and the CDC have advisory committees that have started to make. They haven't made that recommendation as a full recommendation, but they are certainly providing the guidance that that's what they would expect that we would need. And with that, manufacturers of vaccines are already working on targeted vaccines specifically towards the Omicron variants, because right now all of the things that we're seeing that are causing significant spread are variants or subvariants of the Omicron variant. And so that's probably where we'll see that. I expect that to be the next booster that we talk about will be a targeted Omicron, or at least contain a targeted Omicron component.
Mm-hmm. I wanted to ask you, and I guess I'll come back to the other booster question, but late yesterday, and actually I apologize that I didn't get to prep you on this, but it was yesterday afternoon, the FDA had added an emergency use authorization for Novavax, a fourth option of vaccine. A lot of people out there have been talking about Novavax as a different option for people, right? People who didn't want to take an mRNA or the viral vector vaccine. Can you just help me understand, one, what makes Novavax different? And two, do you hope that there will be people who will get that first shot of theirs because this is now available?
Yeah, so we still have to wait on the Advisory Committee on Immunization Practices to weigh in on who who should we be offering that particular vaccine to? It was not approved for booster shots or authorized for booster shots. It was only authorized for a primary vaccine series. But yeah, I am hopeful there will be some people out there who for whatever reason, did not feel comfortable with either an mRNA or a viral vector product, and therefore were awaiting having this particular product out there. What makes this one different is that this is like many traditional vaccines, that basically it contains viral particles that then stimulate your immune system, and with that, makes it a little bit different. So it's similar to many of the childhood vaccines that we administer, that are the ones that are not live vaccines, and similar to most of the influenza vaccines as well. So the things that people get for a flu shot, all of those are particulate matter that stimulate our immune system, different than the way that messenger RNA or the viral vector vaccines work.
And I know that there had been, I remember asking you these questions about people being concerned about the new technology behind an mRNA vaccine. Do you think that this will, you had said a second ago, you're hopeful. I mean, do you think there are people who will say, I see this as a more traditional vaccine, I'm willing to take it?
Yeah, I'm hopeful for that to be the case, but Novavax has been approved in Europe for a while now, and unfortunately, they did not see a considerable uptake in individuals to get that. And if we remember now, we have literally billions of individuals on this planet who have been vaccinated with mRNA vaccines, so we know how safe they are, we know how effective they are, and again, they are readily available. The Novavax vaccine, at best, will only be available towards the end of the month. And that's a best case scenario. And so, it remains to be seen. For those, though, that, specifically are waiting for something like that, I think that it would be a good choice and an option for them as well.
And as we talk about the potential for a second booster for people under the age of 50, and I think they were kind of targeting what 18 plus to 50.
Correct.
Is
that,
kind of a range?
That is really what they'll be looking at, probably, is the next stage.
So, anecdotally, and just kind of through comments on social media, one theme that I see popping up over and over again is people hesitant to take booster after booster after booster. Do you think that this second booster is this going to turn into, just generally speaking, as a booster shot? This is something we're going to need to get every couple of years, similar to other vaccines like flu shots?
Yeah, and again, very typical of respiratory type viruses. The immunity that a human being has lessens over time, which is why all along we have said infection is not going to be your protection from future cases of coronavirus. People get reinfected with coronaviruses that cause common colds over and over and over again. So we anticipated the same thing would happen with the one that causes COVID-19, and we've seen that play out. The problem with specifically the virus that causes COVID-19 is that it mutates at a rate much faster than we've seen with other coronaviruses, in a way that makes it so it becomes more and more transmissible. So yes, just like influenza, which again changes from season to season, we're going to be seeing the same thing with coronavirus and talking about it. Now, I'm hopeful that at some point we get to a point where we're talking about an annual, kind of booster shot for us, or maybe something that even lasts longer than 1 year, rather than every 6 months talking about needing to get a booster. But right now, with the way these mutations are going, science has to catch up to the mutation, and often that means, that the virus actually is faster than we are at developing things.
And I will ask you this question, because a lot has changed since I think I asked it to you last. It's probably more of a question for DHHS, but do you expect, or have you advised anybody at the state that this should be a recommended vaccine for kids attending like public schools? I know a lot of colleges, whether it's state colleges or community colleges, are requiring people to be up to date on their shots. Yeah,
so that's a matter of policy, and not certainly something that I can speak about, but I can certainly say as a physician who has children, I strongly recommend that everybody that's eligible for a vaccine get vaccinated. It is still our best foot forward for lessening the spread in our communities and protecting everybody, particularly those most vulnerable.
And then I just pulled up the CDC map here. This is kind of my last question for you. And I just wanted to check these numbers because I usually get to check them every day. I've kind of calmed down on my graphs to doing them like once a week because we've really seen things kind of taper off. So when I look at the US CDC numbers, 92.2% of people in Maine have at least one dose. When we look at people who are considered, and it's just the way it's written on the chart, fully vaccinated, right? 2 shots or 1 shot of J&J, 80.6. First booster doses were at 57.6. I mean, when you look at these numbers, right, 92, 80, and then as far as first boosters, more than half. What's your reaction to those numbers? Because I know for a long time we were talking about herd immunity numbers around the 80%, and because of these variants, really had to be driven up into like the 90s. So what's your reaction to those numbers?
So first, I mean, again, Maine has been in the top, 4 or 5 or even higher for vaccination rates in every single category from the beginning on. So we should all be very, very proud of that. We also look at mortality rates, and in the state of Maine, despite being the oldest per capita state in the nation, we have, if not the lowest mortality rate, one of the lowest mortality rates. And that's because Mainers did the things that they were supposed to do. And they think more community minded than I think, unfortunately, some of our friends in other states do. We think about the people who are most vulnerable to disease, including our neighbors and ourselves who are older just because of our population. And because we took that caring kind of approach to things certainly has made it so that we have saved more lives. At the same time, we also know that coronavirus continues to be a significant cause of death in our state, and that should be the reminder to us that we need to continue to follow the guidance that the CDC gives us. If it does say wear masks indoors, we should be doing that. And again, I'd like to see that vaccination rate even higher, particularly amongst the boosted population, because that will just further protect all of us from this disease.
You've answered all of my questions, Dr. Jarvis. Is there anything that we haven't touched on that you feel like is a point we need to hammer home for people at this time?
Yeah, just very briefly, that if you do become infected with coronavirus, if you do have a positive test and you are in a high risk category, meaning age over 50 or having some kind of underlying medical condition or immunocompromised, please reach out, because we have tremendous efforts now of treatments that we can do to further protect you from being hospitalized or dying from this disease. And so I just want to encourage people that test positive that they should be reaching out to their provider. And in fact, have a plan for, if you test positive, how you're going to get that out, because it is a very time-limited situation for the treatment. But Paxlovid, the oral medication, works very, very well and is incredibly efficient at keeping you from going to the hospital.
You know what? Sorry, you made me think of it. Sorry, but now physicians, right, can offer Paxlovid. Is it through a prescription? Like, would I just go to my local CVS or Walgreens or whatever and say, hey, I tested positive and I need Paxlovid? How does that process work?
So currently, Paxlovid needs to be prescribed by a provider. There are some changes from the federal guidance that will allow pharmacists to do prescriptions under certain circumstances. But yeah, it is a prescription medication. So you would contact your provider, have that discussion with your provider. They would make sure that it would be appropriate and safe for you to have that medication, and then they'd send it off to your pharmacy, where you'd pick it up at the pharmacy. Currently, we have adequate supplies of Paxlovid, and if Paxlovid's not the appropriate drug, we have other things that we can offer as well.
You're a rock star. Thanks for doing this. I really appreciate it. Karen, is there anything that we left out that you think we need to touch on?
Let's see. No, I think I love that last piece right there. Do you have any idea when this should air?
Tonight.
Tonight?
Yep.
Okay. 4:30, 6 p.m. The whole.
Let me give you a better idea. Let me just check my
Okay.
email
Yeah, you
first.
can let me know later. That's fine.
Yeah, you want me to send you by
And
email?
Karen, please
Yeah.
add to my bio that Chris Costa says I am a rock star. So
I will. I will. That'll be right up at the top.
Let's see. I have here. I don't have it yet. We're going to do our producers meeting here in a little bit to kind of divvy up
That's
the content of the day. But as soon as I know, I'll let you know.
Okay. Good to see you,
all right,
Chris.
Chris, have a great day. Always good talking to you. Thanks, Karen.
Bye,
Likewise.
Dr. Jarvis. Thank you.
Thanks. Thank
Bye.
you both for your time.